Susan Balinger, and I am the Director of Community Relations. I've worked for Sunrise almost 17 years now. I started in this business by volunteering with my daughters at a local nursing home. Enjoyed that and was surprised that they actually employed people to do that job. It is one of the smallest of our Sunrise communities, so about 32 residents with a variety of needs. I have very independent residents, residents who are driving, very active and alert, and then I have residents who have maybe cognitive difficulty or physical difficulties. So we find a home for all of them here. But I noticed something that was common in many of them was the transition trauma. The idea of moving from your home, from moving from a large city to a small city, or from a very small rural setting to where Leesburg would perhaps be a larger city. It was very nice when Mary Ellen Knecht had told me about the Journey program. And I was anxious to have my residents be a part of that, to help them through their journey with us.
I'm Mary Ellen Knecht, and I'm the nurse liaison for the medical team. We have provided services, home health care services, here at Sunrise in the past. And then when the Journey program opened, Susan Balinger was open and saw the need within her residents for this type of service and felt that it would really benefit the residents and the staff who want to do the right thing but don't always have that as a piece of their background skills.
Reached out to them because we wanted that support for our residents in making the transition here. I wanted to ensure that the families had support and our staff. And I think the Medical Team Journey program has done all of that for us, with special educational programs for our staff and with the support group that we have for our families has been just instrumental in developing those relationships. Many of our families have lived cross country from one another for many years, so it's being able to reform those relationships again, and that's very important.
3 reasons why seniors are at an increased risk for behavioral health problems. And the first is that just like all other chemical reactions in the body, the neurotransmitters are slowed down. So dopamine and serotonin production is slowed. Secondly, depression is it's called comorbid condition with a lot of diseases that seniors have, such as heart attack, diabetes, Parkinson's. So just like similar to postpartum depression, if you have a heart attack, you are at 3 times greater risk to have an episode of depression. Depression is also a side effect of a lot of their medications. All right, so first we have neurotransmitters are slowed. Second is it's comorbid with a lot of their diseases and a lot of their medications. And the third is that they suffer a lot of loss. There's a lot of transition and often grief and loss. So where, this generation has met adversity with a lot of courage and determination, when you bring together a perfect storm for some seniors, you still may be at increased risk for depression. The Journey program is a proprietary program that was developed by a psychiatrist in Maryland, Ms. Carson, Dr. Carson, and it covers a lot of materials. We have a whole battery of assessment tools. So when we're talking to a geriatric psychiatrist, we don't just say the person is a little bit less depressed today. We can give him or her a number on the Beck's depression scale. Beck's depression scale is in the public domain, but there are a lot of proprietary assessment tools that are within the program. We also have care kits. And we have a grief and loss care kit, a depression care kit, an anxiety care kit, a dementia care kit, and a booklet for family members who are taking care of their family with dementia. So part of our mandate is to educate and to help and support family members, not just the isolated person. To help your loved one who you might suspect has behavioral health problems, it would just be a simple matter of contacting your physician. And if you understand that there are services available to you that can actually come to your home in the event that your loved one is homebound, and share that with your physician, the physician can call the medical team or they can call, the family can call us directly, and we can have a conversation with the physician and see if the physician thinks that this is a valuable service to help support his treatment goals and plan of care.